Okay, so today we're going to go over how to prepare for foot surgery. And I think the best thing if you're preparing for a foot surgery is to know the proper questions that you should ask your doctor, kind of know what the whole route looks like, and then kind of what's it going to be like to recover afterwards. Just a little primer. The reasons for foot surgery, in my opinion, are if you have any skin breakdown, ulcers, wounds, callus, if you have foot pain that just can't be resolved, or if you really can't find a shoe. So those are the reasons that I do surgery, and you have to kind of qualify for one of those. Whatever your foot surgeon is doing, that would be the first thing to realize. Do you really qualify for it? You know, we don't tend to do too much cosmetic surgery. It's more based on fixing a need. And what are the non-surgical treatments that you've tried before? You know, what's worked? What didn't work? Are there any other possibilities for avoiding surgery? Or is it something that, you know, you've tried other things and it's just time to do the surgery? So those are the things before your surgery. You have to kind of determine this. Are you really a good surgical candidate? And these are something you should think about. Don't just jump into surgery. You should try some of these other types of things to see if it can alleviate. And in my opinion, the biggest things are shoe gear. Shoe gear are key. If you can't try these more anatomic shoes, I'll put a little shoe guide here. If you look at this card, this is a great shoe guide that has different types of shoes, specifically some anatomic shoes that might benefit you. Look at the imaging studies. Have you got an X-ray? Have you got an MRI? Have you done an ultrasound? These should be reviewed with your doctor prior to just kind of show you what's going on and what types of treatments are needed and how specifically the surgery is going to help these get better. What's going to be fixed, basically. We also look at some of these surgical questions. You should ask your doctor where the incision is going to be and how long the incision is going to be. How long is the surgery going to take? How long is the recovery going to take? Specifically, how much time do you have to be off of work? And you're going to be, if it's your right foot, if you can drive or not, things like that. When can you start working out? When can you start walking? For a lot of our patients, that might be 3 months or so, 3 to 6 months. And then will it come back? Is there a possibility of it coming back, or will it be another problem? And then also, what medication should you stop before surgery? These are all important things. And then also any narcotics or pain medication or things like that has to be dealt with. Before your surgery, what I tend to explain to my patients, you're going to do a preoperative visit either with your doctor or at the hospital. That's usually a couple of days before surgery, at least within 30 days, because you have to do a history and physical with your doctor. Nail polish for the females, it doesn't really bother me. Some doctors may have a different preference, but you can use nail polish. You need to get a ride to surgery. So you can't just drive yourself to surgery. I know it's kind of obvious, but you should get a ride there and back because you're going to have usually some anesthesia. Okay. And you have to arrange so you can have time off of work, and especially arrange that someone's going to be there the first couple of days. The main reason that, in my experience, that surgeries are canceled are because people eat or drink something after midnight. So the day before surgery, so I usually do my surgery on Wednesdays. And so the day before, so Tuesday night, after midnight, don't eat or drink anything unless you're advised by your doctor or someone else that you can maybe take some pills with water. But that would be really with your doctor or with the staff. You have to determine that. And then the hospital in our institution, they usually call the day before. So usually about on Tuesday afternoon, they're going to be calling you and letting you know the time of the surgery.